In Rhode Island, Governor Raimondo announced she is suspending child care licenses through April. She says many people are ignoring social distancing orders.
The health department also issuing new guidelines urging you to wear a cloth mask if you leave your home. Eyewitness News politics editor Ted Nesi joins us now from the State House with the details. Ted?
Evening, Mike, Shannon. Rhode Island leaders really operating on two tracks right now. They're asking residents to take steps to slow the spread of the virus, while on their own taking steps to prepare for what they think is an inevitable surge of cases.
This is a top priority for us.
The Rhode Island National Guard designating 3 sites as temporary field hospitals: the Convention Center in Providence, this old Citizens Bank building in Cranston, plus a former Lowe's store at Quonset, all set to be outfitted with hospital beds.
Right now we have over 1,000 that we are planning for. I would sense that based on some of the data points that need to be refined later in the week, we'll certainly get to a point where we'll try to double that availability.
Officials still seeking help from any active or retired health worker.
So I'm asking you again, asking you, begging you, imploring you. Hundreds of you have already signed up. If any of you haven't and you have any capacity, riresponds.org, we need you, and we need you to sign up now.
The health department now urging Rhode Islanders to wear cloth face coverings when they go out, though medical masks aren't necessary.
We recognize that there may be times people are not aware that they have some of those mild symptoms. And so being able to cover yourself helps protect from other people being exposed.
Despite more than 700 Rhode Islanders testing positive for COVID-19 since the outbreak began, the governor says police checks show a significant number of residents still aren't complying with her stay-at-home order.
I need you to stay home. We don't have enough ventilators to keep everybody safe if the surge hits sooner than we think, or if the peak is higher than we think. We don't. More people will die.
And the health department director says that the new advice on covering your face is because they keep learning new things about how COVID-19 spreads. One thing they're finding is that the symptoms in one patient can be quite different from the symptoms in another patient. She says the fundamental advice is the same. If you feel even slightly under the weather, you should stay home. Live at the State House, Ted Nesi, Eyewitness News.
And we're going to go back now to Eyewitness News politics editor Ted Nesi. He joins us now live from the State House with what the governor had talked about earlier today. Ted?
Hi, Mike. Well, as you mentioned earlier in the day, the governor talked about the need to wear masks now, not masks, but face coverings. Sorry, I have a little in my ear right now. Governor Raimondo today also making a new push to get Rhode Islanders to go get a test if they have symptoms for COVID-19.
So for a long time, for 2 weeks, we were saying we didn't have enough testing capacity, and so we were having to limit the testing capacity to folks who were first responders, healthcare workers, in the hospital, et cetera. That isn't the case anymore. Because of a lot of hard work by a lot of people, we now absolutely have the capacity to do 1,000 or more tests a day, 1,000 or more swabs a day. And we need to start seeing the referrals from the primary care providers, and we need folks not to be shy about calling their doctor if they're sick and wondering whether they need a test, because we're ramping up, and the more we test, the better off we'll all be. With that, I will say this: we are still reliant upon out-of-state labs, commercial labs, so please don't expect that you're going to get your test result right away. If you're a healthcare worker, if you're very sick, you'll get a quicker result. But if you're, an average Rhode Islander who feels they need to be tested, it could still take 2-3 days for you to get your results back. But I want everyone to know we're open for business for testing. So please, let's go ahead and get us those referrals so we can get more accurate data around who's getting sick, how many people are sick, and then getting those folks into isolation as quickly as possible.
And as the governor said, if you have symptoms and you want to get tested, you have to go to a primary care physician or an urgent care clinic first, and they will refer you. And if you feel sick in any way, health officials say you have to stay home. Live at the State House, Ted Nesi, Eyewitness News.